Hi there, and welcome to Baby Grow Book Club. If we haven't met before, I am Catherine Muldoon, and I am the online community or online coordinator for Baby Grow. I'm so excited to welcome you here this evening. If you don't know what Baby Grow is, we are a virtual community centre for parents. We bring together support, information, and of course, a wonderful community of parents in the one place. We are a space for all families, and we have things like support drop-ins, we have introduction to local suppliers of support, we have social events coming up, which I'm really excited to share with you. And of course, we have our Baby Grow Book Club, which we are launching tonight with not just this event, but also our Baby Grow Book Club group, where we can come together and talk throughout the month about ideas for books that we do want to discuss and any authors that you would like to meet. But also our monthly meeting, which is going to be on the first Tuesday of the month, where we get together on Zoom, have a chat about the books that we've been reading, and share any information that is just coming out of our heads. Thank you so much for joining us today, and I'm so excited to have you here. Do remember to hit the heart button down below and leave us a comment on where you are, not just location-wise, but where you are in your parenting journey. Tonight, I'm so excited to kick off with a really special event with an amazing author of our selected book this month, which is Why Infant Reflux Matters, and that is Carol Smyth. So thank you so much, Carol, for joining us. So excited to have you, if you can't tell.
Hi, Catherine.
Would you like to introduce yourself to everybody?
I'm Carol Smyth. I'm a lactation consultant. I work in private practice in Northern Ireland, and I'm also a CBT practitioner. And yeah, I'm the author of Why Infant Reflux Matters.
Amazing. Well, I suppose the question that probably all authors get asked first off is, why did you decide to write this book?
Yeah, well, I suppose my interest with reflux really started whenever I had my first baby. I wasn't working in breastfeeding support then. I didn't really know anything about it. I just had my first baby, and he was actually a very settled baby when he was in my arms. But he was really very unsettled when he was out of my arms, and I just did not understand what was happening with him. And I remember when he was 3 weeks old, going to a breastfeeding support group, and I took him in his car seat, and he slept. And I was there for about an hour and a half, and he slept. That had never happened before. He didn't really sleep for any length of time if he wasn't in my arms. And I kept mentioning it. I can't believe he's still asleep. I can't believe he hasn't woken. And one of the health visitors that was there said, "Oh, well, if he's sleeping in the car seat and he doesn't really sleep elsewhere, maybe he has a wee bit of reflux." And that was the first time I'd really heard the term. So I went home and I Googled, as you do. And when I Googled, I found this whole list of things which I could fit to what he was doing. So he wanted to be in my arms all the time. He was feeding more frequently than I thought he should. He didn't want to be laid down on his back. So then I started to think, oh gosh, maybe they're right. Maybe there's something wrong. Maybe he has reflux. And then at 6 weeks old, I was at my GP visit, and so the GP was asking me to get him out of his clothes, and whenever I laid him down, he would cry. When I picked him up, he settled. Happened a couple of times, and the GP said, "I see that every time you put him down, he cries. Maybe he has a wee touch of reflux." And that, to me, was a diagnosis. Mm-hmm. So very shortly after that, he was on medication. He was on Gaviscon, and then he was on omeprazole. But I didn't feel good about it. I did not want to give him this stuff. It did not feel right. And so I went and I searched out for some good breastfeeding support. I got some breastfeeding support. I learned a bit about what brain development was, a bit about baby behavior, and I realized he didn't have reflux. Or he did, but not in a problematic way. He didn't have GORD. He did not need to be medicated. Mm-hmm. So I was able to take him off it. And we fed for a long time, and it was really good. And I wanted to get involved with helping other people to breastfeed as well. And so I started going through, I became a peer supporter, I became a Leche League leader, I went on and did my lactation consultant exams. But I just saw the same pattern over and over and over again in other mums. They're being really worried about their babies, being diagnosed or being labeled as having reflux without any kind of real investigation being done, being put onto medications. And in lots and lots of these cases, the vast majority of these cases, I could see there were other issues that were going on. There were feeding issues, there were other things. So that's really what drove the book. It was working with so many parents and just seeing the same cycles over and over. And I thought, how do I get this message out to more people? And that's what brought the book about.
Amazing. Just feeling that there's something needed to be done and going ahead and doing it. That's so empowering to see that somebody's going out and doing something like that. That's amazing. Something that really hit me there when you were talking, you were saying about diagnosis versus labeling. And when we go to a doctor, when the doctor tells us something, we feel like it's a diagnosis. What's the difference in labeling or diagnosing GORD or reflux for you?
Well, diagnosis can only be done by a specialist. It's a bit like, so yes, my other work is in CBT. So you might go to a GP and the GP might say to you that, you have depression, but that's not actually a diagnosis. That diagnosis can only happen by a psychiatrist. They can say you meet criteria. They can say you have symptoms. And it's very much the same for other issues. They might be able to tell someone with a heart problem that they think that they're having some kind of cardiac problems, but you need to see that cardiac consultant for them to actually diagnose an issue. So the same thing is with reflux. What's happening to parents whenever they go is that they're mentioning symptoms, and because of those symptoms, it's suggested that, well, there's reflux here. Let's do a trial of some medication. But that's not the same as a diagnosis. And to get a diagnosis of GORD, you'd have to see, a pediatric gastroenterologist, and there would have to be investigations done. But those investigations are, they're invasive. If you're going to actually look and see whether there's any inflammation in the esophagus, those are pretty invasive tests. So we don't do them. They're not done unless there are severe problems going on that would justify them. So whenever babies are labeled and they are put on to medications, it's as a trial. It's just to see. Let's see whether this helps.
I wonder, like, how many other issues do we trial medication on for the, there's very few adult issues that would ever be trialed on something directly from what can often be a 10-minute meeting with your doctor when it comes to these things?
Well, I think those proton pump inhibitors are very often trialed in adults as well. Let's see whether reducing acid would help. So I think actually it is a relatively common thing for drugs just to be trialed. Okay, it might be this might be what's going on. Yeah. Let's test it out and see.
I suppose with the difference of that may be that an adult can turn around and say, yeah, actually this is working for me.
Absolutely. Absolutely.
So what are some of the signals that these medications aren't maybe working for a baby, or that they are working and supporting them? And what would the next steps be if it is actually working or isn't working?
Yeah, so it depends. I suppose what the first kind of treatment is supposed to be is Gaviscon. So Gaviscon is, it's there and it's supposed to create a bit of a raft on top of the stomach contents to stop them coming up. That's the idea behind it. Some people find that does seem to make a difference for them. Others find that it makes no difference whatsoever. Some find that babies actually vomit a little bit more, and it's like a jelly type of stuff then that comes up because they put that in there. The big side effect, I suppose, with Gaviscon is constipation. Lots and lots of babies will get constipated from it. The problem with that is that if a baby is constipated, they're going to strain more in order to try and get that poo out. And if you strain, if you're putting all of that, abdominal pressure, that actually makes the reflux more likely. Mm-hmm. Babies are more likely to vomit if they're straining. So the problem with these things is once you get onto a medication, you're almost on a conveyor belt where you do that, the baby gets constipated, okay, that's not working, so let's try the next thing. Or the baby's vomiting more, let's try the next thing. And the next thing is usually going on to an acid suppressant. So it's usually a proton pump inhibitor, and that would be something like omeprazole, lansoprazole, esomeprazole. And again, lots of people find it just doesn't really make any difference. Now they're put on a trial of it for a few weeks, to see. And then if they go back and they say, well, it hasn't really helped all that much, usually the first thing that happens is that the baby is weighed and they've gained more weight. So, well, let's increase the dosage then and see whether it makes any difference. Yeah, so that's what happens for lots of people, and that the research would say that it's very, very effective at reducing stomach acid. There's no doubt about that. Those drugs are excellent at doing that job. But the research would also suggest that it doesn't reduce fussiness or crying. So that, to me, would really raise the question of whether is that fussiness and crying, has it got anything to do with stomach acid in that case?
And that's such a difficult thing to do, or to try and figure out, even as a parent.
Yeah.
Especially in those early days, what a cry means anyway, and you start to get sometimes you get a feeling for it. But if there's not something there, if you're doing everything that you think you can possibly do, yes, how do you work through on that? It's such a difficult process to work through.
Absolutely, and you just want to do something that's going to make your baby more comfortable.
That's so much what parenting is. It's answering our children's needs.
Yeah,
it's just so much of what we're looking for. I remember listening to you talking with the wonderful Claire Hackett about your book and about reflux, and you were talking about what effect these antacids can have on digestion and things like that. Can you tell us a little bit more about that?
Yeah, so this is something that kind of worries me a little bit, because I don't think parents are informed about this stuff. These are powerful drugs. They're not just benign. They are very good at what they do, but stomach acid is there for a reason. Stomach acid is needed there as part of digestion. So it's needed to break down proteins. Proteins they're kind of all bundled up, and what the stomach acid does is start to unwind them into like kind of a much more longer line, so that it can then start digesting, and can, the vitamins that are tied up in it can be released, and and so that they're available. So the problem with not having stomach acid there, and sometimes there'll be very, very little stomach acid there, because the amounts that babies are getting, it's kind of based on the dosages that are used for adults. So babies are proportionally getting much larger volumes of these PPIs than adults would be. So it's making a really massive difference to how much acid that they're producing. So if they're not producing enough there, that affects digestion. It means they're not as able to digest those proteins. It means that they are not able to, there's some vitamins and minerals that are not really bioavailable to them for those reasons. So B12, for example, or calcium, for example. And then there's knock-on effects to that. So the calcium possibly has a big impact. There was a very, very large study done of, it was like 800,000 babies, nearly 1 million babies, absolutely massive. Wow. Babies and children, I suppose. But it found that being on a PPI increased a baby's fracture risk.
Oh my goodness.
So possibly that is to do with the calcium. And it was for several years afterwards. So it wasn't just during the time that they were on it. That the effect of digesting proteins as well, that can impact on allergy, because it's usually the protein part of foods which we've become allergic to. That's why people talk about cow's milk protein allergy. It's the protein part of it that's often the problematic part for us. We need to be able to break down those proteins fully. It's if we can't really break them down, that's whenever they're more allergic to us or more allergenic to us. So there are studies that show that being on acid suppressants increases your risk of allergy. It's also pretty well known in adults that it increases your risk of infections, both gastrointestinal infections, but also respiratory infections. And we're now getting studies in children that are showing that as well, that it increases the risk of infections. So I think, for me, drugs are there for a reason. It's not that I'm saying nobody should use these things. Mm-hmm. They're there for a reason. They're really powerful at what they do. And because of that, I think we need to be really clear about when they're used, and that they're used for the right reason, and that we can make informed decisions about when to use them.
That's exactly it. It's the informed decision part of it. when we're told maybe you should try Gaviscon for your baby, whether it be from your best friend or a doctor, why are we not discussing what the benefits and the risks to that
Yes.
are?
Yes.
And then it's such a big thing that across all sort of parenting and stuff like that there, that we could be looking at what often is called the brain of your benefits, your
Yes.
risks, what are the alternatives, what's your intuition telling you, and what happens if we don't do it, and what if we say no? And these are the
Yeah.
sorts of things that maybe parents could be accessing more information about through books like yourself, by having access to that information.
Yeah.
If there was one thing that you could say to you as a mother who was experiencing this for the first time again, what would you say to yourself?
I would say to myself that it's okay that he wants to be in your arms all the time. That that does not indicate a problem in itself. That indicates good attachment and a normal, healthy, developing brain. I think for me, and this is what I see, and for lots and lots of the parents that I work with, probably the vast majority of the parents, is that we go into parenting our first babies with quite unrealistic expectations of what those babies are going to be like. I was very naive, but I think lots and lots of us are. I don't think I was particularly unusual, but I was very naive about what it was going to be like. I really did think that, yeah, you had this baby and you fed them, and then they would lie down in a pram or a Moses basket, or, you'd put them down, and 3 hours later, they'd kind of squeak and let you know that they wanted to feed again. And, you'd pick them up, you'd maybe change their nappy and feed them, and then they would lie down again. And it was a complete shock to me that he wanted to be in my arms all the time, day and night, and that he did not want to go down in the cot at night either. And I think just whenever you have an idea that they should be able to do that and they're not, then that makes you think, well, what's wrong? Either what's wrong with my baby, or what am I doing wrong?
Mm-hmm.
And both of those they're actually really distressing thoughts. If you think something is that something's wrong with your baby, or your baby's really unhappy and you can't seem to stop it, that's really distressing. And the fact, and that other thought as well, that I'm not up to this, or I'm not doing this right, also a really distressing thought. And so we'll try all sorts of things. And so we search the internet, we start to, we buy gadgets, and we do all sorts of things to try and make this work the way that we think it should.
It's that Dr. Google, he has so much to answer for, and across so much of. There's one of those, a lot of people talk about mommy guilt, but there's also the mommy grief of when something happens. What would you say to somebody who might be experiencing that sort of feeling beyond that, of where should they be going to for support, or what could their next steps be if they're starting to feel that things aren't going the way that they had probably expected it to happen in relation to reflux, or any other aspect that you might be involved with?
Yeah. Well, I do think the first thing is to speak to somebody knowledgeable who understands what is normal baby behavior, because quite often people are, they're feeling this grief and thinking that something is really very wrong when it's not. Whenever they're just getting messages from society which are not realistic. They're just being told things, and they're being told things very often by family and friends who are trying to be super helpful, but the things that they're saying are not terribly helpful. And I think, everybody knows that birth is really difficult, and then you kind of forget about it. You forget what it's like until you're given birth again, and then you're like, oh, yeah, I remember this. I remember what this is like. But I think the same thing is true of the early months. I think the same thing is true of the 4th trimester months. Yeah. I think that those months are really, really intense, and that babies need you, they just need your body. They need it all the time. And it's a really intense time. It's exhausting. You're not getting enough sleep. And you're trying to learn all these new skills on top. And I think that whenever your own parents, or people who are a few years out from that, whenever they're saying to you, well, my baby didn't do that, or you should be able to put them down by now, they're not remembering their 3-week-old baby. Mm-hmm. They're remembering their 4-month-old baby.
And I think that's the way it feels for so many people. It's that blur.
Yeah.
And even when you're in the midst of it, it can feel like a blur of, can't remember what it was like last week, never mind down the line. But there's just so much that could be done to continue supporting people, like you say, talking to people that are in a similar situation to you, because being able to share this feeling that you're not alone. I think that's something that any time that I've been involved with a group, when somebody says, I thought I was the only one, everybody in the room reacts to that.
Absolutely. Because then you realize it's not you. You're not doing something wrong, and neither is your baby. You're just being a mum, they're just being a baby, and that's just the way that it is, and it's really hard. And it's such a relief to realize that.
It's like letting go for so many people of just being able to give themselves a breath to move into being the parent that they want to be. And it comes down so much to trusting your own intuition with these sorts of things, but also reaching out, like you said, reaching out and speaking to people. I did want to jump back a little bit, and you'd mentioned about GORD. And I know a lot of people might question that. We hear reflux, we hear colic, we hear unsettled baby, we hear all these things. But GORD is the actual diagnosis that a child might get if they do go through diagnoses.
Although that term isn't actually, I mean, the term that everybody hears is reflux. They've kind of become synonymous with each other, but they're not. Reflux, the definition of that is really the passage of anything, any of the stomach contents out of the stomach up the esophagus. That includes air. So if a baby is burping, if we are burping, that's reflux. We actually all reflux all the time, but reflux is, and that's why it's described as a completely normal event. You know, it is normal for people to reflux. It shouldn't be problematic. You should be able to do it and it not hurt. Babies should be able to spit up and it not hurt them. And that's why you do see lots and lots of babies who they smile through it, or it doesn't seem to bother them. They pause it a wee bit, or some might spit up and they're a wee bit grizzly, they're a wee bit annoyed about it, but you pick them up and they soothe very quickly. Or they might kind of go like it didn't taste very nice, but they're not annoyed by it. You know, they're okay. That's reflux. That's normal. GORD is where there's some kind of pathology, there's some kind of problem associated with that, there's some kind of complication associated with it. So pain would be what would be typically associated with pain and inflammation. That's what we think about in adults. You think about heartburn, that feeling of heartburn, and that there's inflammation in the esophagus. And so that's what is assumed to be going on for babies whenever they're crying as well. But the problem is, of course, you can't ask babies whenever they're crying. You can't say, are you having some pain here right now? Is that what's going on with you? And like you say, it's very difficult to know when babies are crying what they're crying about, you know, particularly in the early months, because their cries they're not really any different. You know, in the first few weeks, they're going to, the cry that means I've got a dirty nappy is the same cry as I'm a bit scared right now and I want you to pick me up. It's the same, and it's the same cry for something's hurting me. So there's no way to know. And actually, you know, we've not really historically been very good at identifying pain in babies anyway. You know, there's all sorts of painful procedures that have been done, medical procedures that have been done to babies in the years gone past without anybody really realizing that it was causing them pain. So sometimes we do things we don't realize it's causing them pain, and sometimes we're assuming that whenever they're crying it is pain, when really the babies are communicating something completely different. They're communicating that something's going on here with the feed that I'm not comfortable with, or I need you to pick me up, or I'm needing to go to sleep and I need you to move slightly differently, or, you know, it can be all sorts of things.
It's unbelievable that people not as unbelievable. It's just so difficult to try and get that across to anybody in your own circle sometimes, that sometimes babies just cry, and it could be literally that my toe is tucked into my baby grow.
Yes.
And it just happens that that's at the same time that you've just had a feed and things are just feel wrong for them at that moment in time.
Absolutely.
And them trying to learn how to communicate, it's incredible, because they're doing it from nothing. Like, how amazing are babies' brains to be able to do any sort of communication at that
Yeah.
stage?
Yeah.
So it's unbelievable for me just how amazing our bodies are. We do have a couple of questions that have come in.
Okay.
So Holly Carroll has asked, how do we request a diagnosis?
Well, how do you request a diagnosis? You know, if you wanted to get an actual diagnosis, I suppose that it would be your GP would have to think that there was a serious issue going on there that required a referral.
Mm-hmm.
For the vast majority of babies, that's not what's happening. You know, everything that's happening is at a level that can be dealt with within primary care.
Yeah.
And you know, there isn't a serious issue going on there. Babies who have GORD, like who actually have GORD, are very, very unwell babies. You know, if you've got a lot of inflammation going on there, that you know, they're not able to feed well, they're very unwell.
Mm-hmm.
So that's not what's actually happening with vast numbers of the babies who are actually being medicated. What the NICE guidance says is, if you suspect that there is reflux, the first thing that should happen for a breastfeeding baby is a feeding assessment, is a breastfeeding assessment. Now, it doesn't actually say that for the formula feeding babies or the bottle feeding babies. It has ideas about how they should adjust. They should, you know, feed more frequently and have smaller amounts. And I think that's good advice. But I think that they deserve a good feeding assessment as well. I think any babies who are where there is suspected or you're querying reflux, that's the first thing that should happen. There should be a good feeding assessment, because in lots and lots, in the vast majority of these cases, the symptoms that are being described are feeding problems. You know, I'm gonna just read out a wee tiny wee bit.
That would be
here,
amazing. Yeah, please.
if that's okay. And this is the reflux symptoms. So I did a Google to look at the kind of symptoms that are normally associated with reflux. And so the symptoms that are there are spitting up milk, feeding difficulties like gagging, choking, refusing feeds, frequent hiccups, frequent coughing, excessive crying, crying during feeding, crying after feeding, arching during feeds, waking up at night, comfort feeding or frequent feeding, poor weight gain, green or yellow vomit, vomit with blood, recurrent pneumonia, projectile vomiting, colicky or windy, high weight gain, trouble with self-settling, hoarse voice, teeth that show signs of acid erosion, a wheeze, not comfortable lying on their back, or wants to be held constantly. Now that's a vast array of things there, but you can kind of divide them into three groups, which is what I've done. There's a large group there which are feeding behaviors. So spitting up milk, frequent hiccups, crying during feeding, crying after feeding, arching during feeding, comfort feeding or frequent feeding, poor weight gain and high weight gain. Those are feeding issues. So those kind of things should be investigated as part of a feeding assessment. If a baby is arching during feeding, there's a difficulty going on there with the feeding. So that needs to be looked at. And then there's the unsettled behaviors. So things like excessive crying, waking at night, colicky or windy, trouble with self-settling, not comfortable lying on their back and wants to be held constantly. To my view, lots of those things should be looked at as part of the feeding assessment as well, because the excessive crying might be to do with feeding issues. Waking often at night, that might be normal. It might be that what you've been told is normal sleep is not what is physiologically normal sleep. Or it might be that there are some feeding issues that are going on. So a lot of those things would be picked up and should be picked up as part of a good feeding assessment. The third group, the medical issues, that's things like frequent coughing, green or yellow vomit, blood in the vomit, recurrent pneumonia, persistent projectile vomiting, hoarse voice, the teeth that show signs of acid erosion, and wheeze. Those are clearly medical issues. Those need to, a doctor needs to be looking at those really carefully to see what's going on. But those are not the things that are happening in the vast majority of babies that go to the doctor and get some Gaviscon.
Thanks so much for sharing that. I mean, those are things that if parents can be able to look at that and see that it's almost like the triage of where they could be going to find out information of at what level they are. I think that's a really, really important tool for parents to have access to. Thank you so much for sharing that with us. I do have one more question again from Holly, who said, why do medics say reflux tends to resolve around 6 months old? Have you found that to be true?
Well, if you kind of think about what's going on with babies, so they're on a completely liquid diet. And, you know, there's a wee sphincter, a wee ring of muscle that sits at the top of the stomach. And that's, you know, whenever stuff goes into the stomach, then it's supposed to close and keep it in there. But it's not terribly mature in young babies. It's just a little bit leaky. And babies also don't have an awful lot of core strength, you know, so they spend a lot of their time either horizontal or semi-horizontal. So it's a bit like, you know, filling up a bottle with water and just having the cap on a bit loosely. If you leave it down, stuff's going to leak out. So that's why it very commonly happens with young babies. But as they get to 6 months old, they hopefully should have been doing lots and lots of tummy time before then. So they will have developed much better core muscles, and they're starting to sit up. So gravity has a bit of an effect there whenever they're sitting up. They're also going on to solids at that time. So their diet is beginning to change. It's no longer this completely liquid diet anymore. There's some solids in there as well. So all of those things together mean that the reflux is less, it's less likely to happen, or it's less frequent, I suppose.
It just makes sense. I mean, when you're thinking about all these things coming together, it makes so much sense. Thank you so much, Carol. It's been absolutely amazing speaking with you. It's been so informational, and I'm sure everybody that's watched has got so much from it. Fingers crossed people will be watching on review again, and if you have any questions, I'll be sure to pass them on to Carol as well, and hopefully we can find some sort of connection for you there to talk as well. Everybody, if you can join us on the Baby Grow page, give us a like and find out all more information. Also check out the Baby Grow Book Club group. If you do want to go ahead and purchase Carol's book, Pinter and Martin, the publishers, have wonderfully given us a discount for purchasing the book. If you use Baby Grow 10, you'll get 10% off your purchase. We will be running the competition through until tomorrow, so you have a chance to win a copy yourself by going to the post on our Facebook page, leave a comment, let somebody know about the event, let them rewatch it to find out more information. We will be having our monthly get together through the Baby Grow page and on Zoom. So I'm really looking forward to getting to know you all. And thank you all so much for joining us tonight. And again, thank you again, Carol. You've been absolutely amazing.
No problem. Catherine, do you want me to read a little tiny bit more about,
that would be
regulating? Because it would be a lovely thing to leave you with, I think.
I would love that. Thank you so much, Carol. I really appreciate that. That would be amazing.
Okay. So yeah, I just wanted to do a little bit, because we've talked a wee bit there about the actual symptoms and stuff. There's lots more in the book, I should say, as well. There are some people who will find that reflux is painful for their babies. And there's allergy, and there's things that should be investigated as well. So all of that is in the book too. But for a really large number of people, what's going on is that their baby is exhibiting normal baby behaviors, but our society doesn't really recognize them anymore. It doesn't really understand normal baby behavior anymore. So the final chapter in the book is called Beyond Reflux, Co-Regulating Your Baby. So I thought it would be nice just to read a couple of wee pages out of this. What if I told you that the reason there is such a difference in what you expected of your baby, 3 hourly feeds, the ability to sleep alone, the ability to lay down, and the reality, which is frequent queuing for feeds, wanting to be held and to sleep on you, is because you've been fed inaccurate expectations throughout your life? What if I told you that Western society's understanding of babies and what babies need is flawed? What if I told you that your baby needs your body intensely, just so their body works properly? Our babies need a lot of care. In order to understand how much, I need you to suspend all your current beliefs about babies and about parents. Put everything that society has told you on hold and think about our babies as you would look at another species. The first thing to understand is that our babies are born with very immature brains, and that immaturity means that our babies are not capable of doing very much to keep themselves safe and alive. Other mammals that we're used to seeing on farms, cows, horses, sheep, goats, pigs, have babies who are able to get to their feet very quickly and follow their mother around. They can flee from predators. They can find their way to their mother if they're separated and can initiate feeding. In stark contrast, a primate baby, such as a chimp or a gorilla baby, is able to cling to their mother and spends most of their time on their mother's body. They stay attached to their mother's front for 3 to 6 months and then move to their mother's back. At around the age of 2, they'll start to climb down from their mother, venturing up to 16 feet away before returning to their mother's back. They only start sleeping on their own at around 4 to 5 years of age. That's a long time for an infant chimp to need to be attached to their mother. And a baby chimp is actually more mature than a baby human. At birth, an ape's brain is about 50% the size of an adult ape brain. A human baby at birth, however, has a brain which is only 25% of the adult brain mass. Our babies cannot venture away from us and return. They can't get away from danger. They can't make their way to us if they need to feed or have some other need met. They can't even cling to us. This means they're entirely dependent on us to care for them. Their biological expectation is that we will behave much like the chimp mother. This means babies need an awful lot of time, attention, and work, perhaps much more than you have been led to expect. Why would evolution or nature design our babies to be so helpless and to need so much energy and labor from the parent? The answer lies in our pelvis. If we were to let our baby's brain go to 50% of their adult size, they'd have a much larger head at birth. And since we birth that head through our pelvis, that would mean we need to have a much larger pelvis. A larger pelvis is heavy, too heavy for walking upright. An ape can pass a much larger head through its heavy pelvis because they walk on 4 limbs. But an animal that walks on 2 legs has to have a much smaller and lighter pelvis, and therefore can only give birth to a baby with a smaller brain. At some stage in the past, we as a species made an unconscious evolutionary decision about walking upright. As an evolutionary trade-off for the advantage of being bipedal, our baby's gestation changed. Rather than having a gestation completely inside the womb, like a calf, for example, we created a situation where we split a baby's gestation into 2 parts, part of it inside the womb and part of it outside the womb, but in our arms. A baby is much like a kangaroo joey. The joey is born, makes its way to the pouch, climbs inside, drinks milk, and completes its gestation. Our human babies are born, are placed in our arms, feed at the breast, and complete gestation there. Our arms are our pouch. Those small, immature brains aren't very good at keeping the body system stable. As mature adults, we can keep our heart rates regular, we can bring our breathing under voluntary control, we can manage our temperature, we can look out for threats, we can recognize our emotions, usually, and we've learned to manage our stress and our emotional responses to some degree. Our babies cannot do any of these things well. They aren't even very good at the basic things like stable, regular breathing, heart rate, or temperature unless they're on an adult body. You may even have noticed that if lying alone, sometimes your baby might seem to stop breathing for a brief moment. Babies cannot regulate these systems themselves, but they can borrow our adult regulation when held against an adult body. That adult keeps the baby's body systems regulated. The adult heart rate regulates the baby's heart rate. The stable adult breathing regulates the baby's breathing, and the adult temperature regulates the baby's temperature. Babies literally need our bodies. They need their body to be against ours. This is co-regulation, a state where the adult is required to regulate the infant's body. So society may tell us we should be able to put our babies down and that they should be able to sleep alone. But neuroscience tells us that when babies are separated from us, even by a couple of feet, their bodies become dysregulated. They become stressed. They move into a fight or flight state. And once they do that, they release stress hormones. So when babies are stressed, they're going to cry, they're going to spit up, they're going to need you more. So that's, I think, what's going on for lots and lots of people. And I wish we could get more message out there about how normal it is for babies to need to be held.
That's incredible, Carol, and it was just beautiful listening to you read it as it was written. Absolutely incredible. And our arms are our pouch. That's going to stay with me for a very long time, and I'm sure that I will repeat it to many parents going ahead. Again, thank you so much for sharing that with us, and thank you for spending the evening with us and for being our very first featured author. We are so honored to have you on. And we're really looking forward to hopefully working alongside you in the future and doing more stuff together.
Lovely. Look forward to it.
Have a really lovely evening, and thank you everybody for joining us. It's been amazing, and thank you for interacting. We've had some amazing comments underneath the video of how things have just started to click with parents having listened to this. So you've made such a difference, Carol. So thank you so, so
Wonderful.
much.
Thanks, Catherine.
And good evening, everybody. We'll see you soon.